Welcome to the Legacy Education CPT Modifiers review. I am Tiffany Roach, the coding coach, and I will be reviewing the most common CPT modifiers with you. CPT is a registered trademark of the American Medical Association, or the AMA. Legacy Education is not affiliated, endorsed by, or sponsored by the AMA, and all rights to CPT are owned by the AMA. First, let's cover modifiers that will affect global surgery packages. Modifier 24 is related to an evaluation and management service that is provided to a patient by the same physician during the post-op period for a service that is completely unrelated to the surgery. For example, a patient has surgery on their right knee. On day 32 of the post-op period, the patient injures their wrist and returns to the orthopedic surgeon. Since the patient is already in a global period for the knee, during which the additional office visits are not billable if they are related to the surgery, the orthopedic surgeon would append modifier 24 to the evaluation and management service to indicate that this visit was related to something other than the knee surgery. Modifier 25 indicates a significant and separately identifiable E&M service by the same physician on the same day of the procedure or other service. For example, patient has a laceration on their leg and presents for an intermediate repair. During the visit, the provider notices some wheezing on inspiration, performs an appropriate exam, and determines that the patient also has an exacerbation of asthma. The patient is prescribed steroids in order to help with the asthma. The code for the repair would be reported, as well as the appropriate level of E&M with a modifier 25 to indicate that the service was unrelated to the laceration repair. Care must be taken when you are applying modifier 25, and it would not be expected to be reported for every E&M service. Modifier 57 is used when the patient is seen and being taken to surgery within the next 24 hours. If you remember that the global surgery package includes the day before a major surgery, therefore it makes that visit not billable. However, if the patient is seen emergently and needs surgery quickly, the surgeon can append modifier 57 to indicate this situation and carve out that visit from the global package. For example, patient presents to the emergency department with lower right quadrant pain. The surgeon is called in and performs an exam and orders an abdominal scan. It is determined that the patient has appendicitis and needs to have it removed emergently before it ruptures. The surgeon should report the E&M service with modifier 57, indicating that the exam was necessary to determine the appropriate surgery, in addition to the code for the appendectomy. Modifier 58 is used to indicate a staged or related procedure by the same physician during the post-op period. It can be follow-up procedure that is more extensive than the original procedure, and it can also be used to indicate therapy performed following a surgical procedure. For example, a patient has a lesion that turns out to be malignant without clear margins. The patient is brought back to the operating room 7 days later, and the second, more in-depth surgery to remove the cancer is submitted with your modifier 58 to indicate that it is related to the primary or the first procedure. Modifier 76 is used to report a repeat procedure or service by the same physician or other qualified healthcare professional. An example is a patient who goes to the emergency room with trauma to the chest. A 2-view chest x-ray is taken that shows a pneumothorax. After a chest tube is placed, then a repeat 2-view chest x-ray is taken to verify the placement of that chest tube. You should report 71046 and then a second instance of 71046 with a modifier 76 indicating it is a repeat procedure by the same physician. Modifier 77 indicates a repeat procedure by another physician or other qualified healthcare professional. An example is a patient who sees the family practitioner for chest pain, and that physician does an EKG and then refers the patient to a cardiologist. The patient sees the cardiologist on the same day, and then the cardiologist performs a repeat EKG. The second EKG should be reported with a modifier 77 to indicate a repeat procedure by another physician. Modifier 78 is used when there is an unplanned return to the operating room for a related procedure during the post-op period. For example, a patient has gastric bypass surgery in January. In March, the patient is diagnosed with an incisional hernia at the location of the bypass incision, and the patient is taken back to the operating room in March for an incisional hernia repair. The hernia repair is related to the bypass surgery, and modifier 78 is used on the hernia repair code. Modifier 79 is used to report an unrelated procedure or service by the same physician or other qualified healthcare professional during the post-op period. For example, a patient has an open reduction of an ankle fracture done in October. In November, the patient has appendicitis and has an emergency appendectomy. The appendectomy is unrelated to the ankle fracture, and therefore it is coded with modifier 79 appended to the code for the appendectomy. Modifier 22 is appended to surgical CPT codes when the amount of work to perform the service is significantly greater than what is typically required. To support the use of modifier 22, a copy of the operative report must be sent along with the claim. The detail in the operative report must describe the additional work and the reasons for the additional work, such as extra time, difficulty, patient condition, or complications. Modifier 50 can be appended to services that are done bilaterally. You want to check with your payer to determine if they want the services reported with a modifier 50 or on separate lines with an LT-RT modifier on each one. Pay close attention to your code descriptions, as some will have unilateral or bilateral within that description. And in those cases, it would not be necessary to use modifier 50, as the code description is specific already. Modifier 52 is used to indicate reduced services. When a procedure is partially reduced, ended early, or eliminated at the provider's discretion, append modifier 52 to the code. Modifier 53 represents a discontinued procedure. If the procedure is terminated due to extenuating circumstances or the circumstances that threaten the well-being of the patient, you should use this modifier with the procedure code. Modifier 51 is used when multiple procedures are performed in the same session by the same provider. Services are ordered in descending order based on the relative value unit. So an example is shown for the orthopedic surgeon who performed a closed treatment of a femoral shaft fracture on the left leg, and then a closed treatment of a right knee dislocation during the same operative session. This is coded as 27500 with an LT and 27552 and a 51 and RT modifiers. Modifier 51 is not used on E&M services, physical medicine, or rehab services, and the provision of supplies such as vaccines or codes that are designated as add-on codes. Modifier 59 indicates a distinct procedural service. Documentation must support a different session, different procedure or surgery, different site or organ system, separate incision or separate excision, separate lesion, or separate injury. An example is going to be a patient who had a colonoscopy and a lesion is removed from the proximal to the splenic flexure. During the same colonoscopy, a biopsy is taken of a different lesion. Both codes are reportable using modifier 59 on the second procedure. Now, there may be times when a surgeon requires assistance during a procedure. In the instance that the assistant is present for the entire operation, or at least a substantial portion of the procedure, modifier 80 should be appended to the assistant's claim. When the assistant is only needed for a short period of time, modifier 81 would be appended to their claim. And lastly, when in a teaching hospital that employs surgical residents, and a qualified resident is not available to assist, and another surgeon has to step in, then the assistant would append a modifier 82. Some services are a combination of professional and technical components. The professional component will identify the work of the physician to perform, read, interpret, or supervise that service. Now, your technical component identifies the costs that is associated with owning the equipment, employing the technicians, the supplies, and the overhead equipment. When services are billed without a modifier, they are considered to be global or inclusive of both technical and professional components. To separate out the technical and professional services, your modifiers TC or 26 should be applied to the CPT code. An example is when a patient who comes to the office with wheezing and congestion. The physician takes a 2-view chest x-ray using his or her own equipment and then sends it out to be read by a radiologist. The office will report 71046 with a TC modifier for the use of the equipment, and then the radiologist would report 71046 with a 26 for their interpretation and report of the films, also known as the professional service. If the physician performs the x-ray in the office and performs the interpretation of that report, then code 71046 without any modifiers would be appended to indicate the global service, since both the technical and professional components were performed. Modifiers 90, 91, and 92 are lab modifiers. Modifier 90 is used when a lab procedure is performed by an individual other than the treating provider. The modifier is often used to bill for lab services that are purchased from an outside lab. Modifier 91 is used for repeat clinical diagnostic lab tests. If a test is performed more than once on the same day to obtain subsequent test results, you should append a modifier 91 to the subsequent identical test. Modifier 91 is appropriate to use when testing for multiple arterial blood gases for a patient in a 24-hour period. However, you would not use it if the same test was performed to confirm the results of a previous test or if it was repeated due to equipment malfunction. And then modifier 92 is the alternative lab platform testing, which indicates tests that use a kit or transportable instrument that is of a single use. So some examples are your HIV testing for 86701 through 86703. These tests do not require permanent dedicated space, and it may be hand carried or transported to the vicinity of the patient for immediate testing at that site. Thanks for reviewing the CPT modifiers with me. Please make sure to subscribe to the channel so that you can be notified of any new videos that are released.